Still people not killed. Can't change the game. No, how I know. I don't. Here's all this is. If you were to be somebody and players, well, you were that's your dollar house. Yeah, before I gotta go away and take his one for the league. He feels so best. Dude was he's a great show. He was there. Right. He was great. Great. I'll give a couple of announcements here. I want to make sure you remember about spring fling coming up in April 17th. You'd like to go to that? It's for Violence Free Future, good fundraiser. And golf outing, it is on when is it, baby?
May 15th, Dave.
Thank you. I know it's on there. If you'd like to play, let us know. The schedule. I guess I should be that same. Speaking of that, man, it's empty.
Well, welcome to Rotary. Would you join me in prayer? Almighty Creator, we pray for the bifocals of faith so that we can see the concern of the moment right under our noses. May we also see further on your purpose and work with all your plan in the world you have made. We pray for the ability to see at close range our as our trouble to become solution first in the giving of time and effort or money. And we also pray for the ability to see clearly in the distance for those who are in partnership with us. May we look forward to the vision of those bifocals of faith, and then act. Amen.
Amen.
Thank you. I'm gonna use my connection this time. Violence Free Future, it's taken in here when I was saying. Did I forget that name? That is in 17. And the golf outing is.
May 15th.
So if you want to play that, please register. John. We are sitting at 64%. And appreciate this. And Chris. You don't know Chris. You know hard. You ready to give your report?
Thanks, sir.
Right.
Yeah. All right, good afternoon and hello again to all of our Rotarians and our incredible speaker who will be up here shortly. And welcome again to the Rotary Club of Beavercreek. And not only is it Friday the 13th, but coincidentally, it is also Employee Legal Awareness Day. So as a formal HR guy, I have a great tip for everyone if you ever get called into HR's office. And it is, if you ever go to start the sentence with hypothetically, just don't. Don't say what's all after that. Just keep that to yourself. Also, if I do ever become HR of the United States of America, there is one bill that I would pass immediately, and that would be that if you reply all to an email asking everyone to quit replying all to that same email, grounds for immediate termination. And then anyone who else replied all to ask why they were included in the email, 1 week suspension without pay. Now moving on to birthdays and anniversaries, and which is, I know this is the moment you all will take your applause for, but today, Mr. Jim Rudd celebrated birthday. I'm not going to say the age, but I'm going to say 40-ish. Look, we have no partner birthdays coming up, but we do have 2 member anniversaries. Dan will be celebrating 20 years on the 17th. And also on the 17th, Greta will be celebrating her first year with us. Some other good things that happened today, on this day in history, going all the way back to 1635, the first public school in the U.S., Boston Latin School, was founded. And does anyone want to take a guess at who the most famous dropout from that school was? Benjamin Franklin. Oh. And fast forwarding to 2004, astronomers announced the discovery of the universe's largest known diamond, which measured only 2,300 miles wide and is only 10 billion trillion carats, which sounds like a number made up by kids. And that is the official measurement of this diamond. Actually, the diamond is a remnant of a white dwarf star that researchers also named Rosie after that famous song by the Beatles. Moving on to some fun things to celebrate. Saturday, Mr. Cusack, I am sure you have not forgotten what tomorrow is.
I'm sure.
Yeah, covering up ears. It's National Library Lovers Day. On top of that, it's also Reach Your Child Day, so you may be a little busy tomorrow on top of other festivities. Sunday, we got Susan B. Anthony Day, followed by National Wisconsin Day. On Monday, we have, of course, President's Day and Family Day, which I think Family Day should be every day, but that's just my personal opinion. Tuesday, we have National Random Acts of Kindness Day. And if you don't feel like spreading random acts of kindness, you could also celebrate My Way Day. Wednesday, we have by Steve Brown's favorite day to celebrate this upcoming week is Hockey Stick Salute Day. And then for all of us non-hockey players, it's cow milk while flying in an airplane day. Thursday, we got U.S. Coast Guard Reserve Earth Day, along with Iwo Jima Day. And then if we want some other things to do this week, not much going on that I found, but on Thursday, our friends at the Chamber will have their monthly Business Links event at the Mills Morgan Tower in the Pentagon Room from 4:30 to 6, and that is always free to attend. Got some awesome Beavercreek School updates. I will start first with the 7th grade girls basketball team are officially the 2026 GWAC champs after they defeated Kettering Middle School 26-21. Following suit, the women's varsity basketball team last week beat Centerville, Northmont, and then Points School. They beat Points 72-14. Men's varsity basketball did not do the same. Unfortunately, they lost to both Centerville and Xenia. JV teams, women's JV lost to Centerville. The men's JV team beat Xenia, but the JV team lost to Xenia. The women's varsity bowling team, I don't know if this is good or not. They are 13-0 for the season after they beat Springfield. The men's varsity team beat Springfield and clinched a share of the GWAC championship. And then in women's wrestling, Leah Crawford placed second in the Iron Mountain tournament at Belfont High School, which was noted as one of the toughest girls wrestling tournaments in the state. On her way to the finals, she defeated someone who was undefeated with a record of 23-0 and earned second place in this 25-person bracket. And probably what was even more impressive is this was her first wrestling competition in 4 years. Her and another lady, Alexis, then went to be runner-up and take 4th place at the Kaiser Invite at National Trail High School. And then we'll just jump to our favorite parts here. Since I have been gone and I don't think fines have been collected as well as how I do it, I'm going to up it to 3 fines today and see how that goes. First one, obviously, if you're not wearing your badge or if you're late, obviously those are $1. If you've never been to Wisconsin, that's going to be $1. If you've never played a game of hockey in your life, that'll be $1. And this one, if you've never milked a cow while flying in an airplane, it's going to be $1. Wow, David, time for happy bucks. Paul.
I started to say line because you may not mention Beavercreek High School's team is in the sectionals tonight at track. And one of the members of our club is swimming 4 events. Oh, wow. You missed it. I missed it. Well, it wasn't on their Facebook or Twitter, so.
You still donate an hour.
I'm happy about.
Anybody have?
It's a flat.
It's having a few right now.
You? That's not all I count anymore, long term. It's all over the. Any more happy birthdays? Oh, done?
I've got a happy five. I spent the morning at the Dayton Regional STEM School reviewing some capstone projects for the seniors. I just look really good hands looking at these young people. This is amazing what they're doing and how they're doing it. I'll focus there. The other thing is on the Rotary golf hunting. Things are coming together. I got my first foursome, which is great. Jim. So we need more of those. We need more donations. We need more sponsorships, whatever. So if you haven't got a sponsorship, then you agree.
Water, thanks. Sure. Brian, do you have? Or you want? Anybody else?
Invite.
I think I will. You don't remember James Turpin?
Yep.
His son was in the bowling league in Beavercreek, and he rolled a number of 3,000, the 300s, 300 games. But he went to college and started a bowling team, and they just won the first tournament. So I thought that was pretty neat. Okay, 50-50.
Considers. I don't know. It's a jingle in years.
Outrage. Winning number 383-482. Boys,
You're ready. It's coming out all but one number.
good luck.
This first nation. That's What's it on six? Yeah.
Yeah, I know. You all know that money goes toward our Christmas baskets. The ones that the people don't win. All right, Pete, you ready to introduce our station?
Sure.
Thank you.
All right, well, it is my pleasure to introduce Alan Zins. He's the founder and principal advisor of Medicare Resource Group. Alan has spent more than a decade helping individuals and families navigate Medicare, supplemental coverage, and prescription drug plans with clarity and confidence. His work is centered on education, integrity, and personalized guidance so people can make informed decisions as they enter retirement, which is very important. Alan is also a frequent community educator who believes that an informed community is a stronger community. Through seminars and one-on-one support, he works to remove confusion from the Medicare process and provide steady guidance during an important season of life. Please join me in welcoming Alan to our club.
Thank you. Thank you. Good afternoon, everybody. Microphone. So many people in this room I respect. Wow, microphone. Good afternoon, everybody. So many people in this room I respect. I really appreciate being invited here and just to be able to share knowledge and tell you a little bit of what I do and how we serve the Beavercreek community. My name is Alan Zins. I am the owner, along with my lovely wife, Hope Zins, over there of Medicare and Retirement Solutions Group. We just rebranded, Pete, so we were a little bit close on that. So that's okay.
Um, we've been in the rewriting process for the last 2 months, so that's been a lot of fun. Still inside the mall at Fairfield Commons. I've been there almost 6 years now, and I've been in this industry almost 15, so I'm working on it. And I'm truly passionate about what I do. I was telling a gentleman in the restroom, I go, it's nice to be inside of a career field that you love more now than you were when you started. So thank you again for having me here. I'm grateful. Now, a lot of the things that we do here at Medicare and Retirement Solutions Group is we help people put together the complexities of Medicare and retirement for when they cross that bridge. I'm an independent fiduciary, and for the most part, we just help people get the confusion out. They come to me and about every day of the year coming into my office inside the mall. And they said, hey, I heard this about this, and this commercial said that. Is there any legitimacy to any of that? And most of the times it's not, but it does bring people into my office, which is a lot of fun too. So I help them clear it up. One of those things that folks also come on in and they said, I have no idea what Medicare even is, what it does. I was just told that since I'm turning 65, I need to either make a decision about it. And that's what we do. We help them take them where they're at, meet them where they're at, and just show them, hey, this is what you could have, this is what you could do, and just offer solutions. We're not pushy. We're educators by heart. And what we do is we just try to help people put the pieces together and pull them through it. We do a lot more than just also Medicare. Also, we do a good deal of retirement planning as well, which includes long-term care. We structure income streams for retirement. We have risk-adverse strategies that we help folks with. But I'm here to mostly speak about the Medicare side of the business today. Because people have a lot of questions about that. There's a lot of commercials out there that make people just more and more confused. And so that I never mind because it brings people to my door and I tell them the truth. But in this case, they're like, well, what's true and what's not? And so what do I need and what don't I need? Am I going to get penalized? Am I not going to get penalized? And I realize that in Medicare, it's not for everybody in this room right now. I can see a lot of folks that aren't even going to come close to Medicare. So just by law, Medicare is health insurance for folks age 65 and older, or for 65 and younger with certain disabilities. In fact, my youngest client's 11. She was born without legs, so she's been on Medicare disability her whole life. One of those things. So humbling career, that's for sure. It's one of those things where you get attached to your clients. I saw my very first client from almost 15 years ago, and I have several clients that have been with me over a decade. And so when life changes and the good Lord takes them on, it becomes it's kind of the sad part of what I do. But the rewarding part of what I do is I get people lined up with the right plan and putting them in the right situations so they can make informed decisions, but also just have a better life. I tell folks all the time, I go, if I can't put you in a better situation, I'll let you know. If I can't, but you have options out there, and most people are not aware of that. And I guess I kind of went over this a little bit already. Like I said, with the Medicare, we help people because it's a decision that you have to make in your life to say, hey, how do I protect the hard-earned money that I've earned over these years, and how do I put the pieces together with the entire retirement portfolio? And so that's where we come in. But so a little bit of education about Medicare right now. Folks are living longer than they ever have. According to the Social Security Administration, folks are living another 18 to 21 years on average in the United States. Unfortunately, us guys, we're on the 18 side. So women live longer than us. They're not as big as knuckleheads as we are usually. But that's the thing. So you have to plan and prepare for that. So folks like that make it to age 65 in the United States, plan to live at least another 20 years, and you have to plan for that. Medicare is very much a part of that. They have to figure out what's important for me. Is it a Medicare supplement? Is it a Medicare Advantage plan? I have TRICARE for life. I have VEA. What do I do now? Do I just keep original Medicare, or do I want all those little bells and whistles that all my friends tell me about? That's where we come into play. Do I need a drug plan? Do I need that? Is that something that is required of me? Is it having a Part D? And so a lot of people are saying, what's Part A and what's Part B? And by the way, how do I get a Part C plan? Any of you ever wonder about that, especially the ones on Medicare? Like, what is a C plan? You know, what is Medigap? What does that mean? So when folks are needing advice and literature and information, they can come to us. I get over 1,000 people a year that walk through my doors that have questions, and we're there to answer. And like I said, if we can't answer your questions, we'll let you know, but we're good resources. I have a network of other professionals that are geared towards helping seniors with their retirement planning. So it's not just me and my staff in my office. It's really the community that we serve here as well. And so one of the things that I also want to talk about a little bit about is what are some of the differences of some of what they call these special enrollment periods. People have heard about, how do I change my Medicare plan any time of the year? Well, there's lots of reasons. There's nearly 30 different ways that people can change their plan. And right now we're in one called the Medicare Advantage Open Enrollment Period, which you don't see as many commercials about right now as you do about the one in that goes from October to December. That's the Medicare Advantage, or that's their annual enrollment period, which is for anybody on Medicare that is looking to make a decision and change. So there's lots of other ways, folks. They say, hey, I made a move. I went from, let's say, 45432 to 45431. Well, that opens up a sort of enrollment period for folks on Medicare to be able to change their plan regardless of when it is, any time of the year. Most people don't know about that. There's another thing that we do in our office is we help folks that are less fortunate. And I don't mean that in any kind of a derogatory way, but a lot of folks are having a hard time paying for their medication costs. They're having a hard time paying for any of their medical costs. And so in our situation, is we help them find some of those subsidy programs that may take some of the load off. There's plenty of things out there for people that don't know where the resources to go. And so that's where they come to us, and we'll steer them in the right direction. I am going to leave this open to a question and answers after this, by the way. I'd love to have you, pick my brain. That's what I'm here for. Like I said, I've been doing this almost 15 years now. And by doing that, integrity is everything in my business. If you don't have honest, if you're not honest with people, they're gonna pick up on that, and they're gonna go somewhere else. Or the last thing I want to do is, I feel like I've been given a huge responsibility in my life of helping people make this accurate and wise and prudent decisions about their retirement planning. So how do we do it correctly? So going back to the Medicare thing, and the nice thing about Medicare is you're not really bound to any plan. And so really the folks on Medicare have the upper hand on knowing that, hey, listen, if this plan doesn't handle my situation the way I need it to, I can get out of it and change to another one. At our office, we represent 11 different companies. So you have a lot of choices, and it's all the big names you've ever heard of, and even some of the sub companies you probably haven't heard of, but you have variety. And I don't know if most of you know, but there's over 209 different Medicare plans in this area alone. It's like, how do you find the one that's going to be right for you? Make sure your doctors are covered, make sure your medications are covered. And if so, who covers your medications the best at the pharmacy that you choose? And then where do you find them at the lowest cost? Because that's a monthly expense for everybody. So it's one of those things that we do to help the community. We feel like we also do free education. We like to help empower our clients, whether they remember what we say or not, is another thing, but we do tell them, provide them with literature and information so they can, if they don't remember what I said, they can go back and read what I said, which is really nice. So we do free reports for people when it comes into our office on what is next and how to handle where you're at. And I do have some of those bifolds back there if anyone's interested in having some. We have plenty for whoever needs them there. But right now, I want to also just open it up for any questions and answers. I don't have a lot to talk about with Medicare. I'm always open to have one-on-one conversations. Consultations are literally always free. There's no hidden agenda behind it. There's no sales pitch. It's really just what's your problem? And maybe I can help you find a solution to that. And I'd like to think with a lot of my experience, and I've done it I've had over 2,000 interviews with people in their Medicare and retirement. So there's not a lot of things I haven't heard, but I do like to get stumped every once in a while. So the nice thing about this career is that you're constantly learning and you're constantly evolving into the better version of yourself every day. So, does anyone have any questions? Yes, sir.
Why are you compensated?
Good question. This gentleman asked me, how am I compensated? Well, what we try to do is we get compensated by the companies. And we're regulated, so you have to be professionally licensed to do what I do, and all the companies pay us the same, especially on the Medicare Advantage side. They have to be in the regulation. So whatever plan, if you went with a Part C plan at one company, they have to pay me the exact same way. So to answer your question, we try to demonstrate value and competency. And if you see some of my reviews, you'll see where I've made a difference in people's lives, and that's what we want. If I can bring value and put yourself in a better situation, we hope that you'll do business with us. Therefore, we will be compensated by the companies, and they pay us ongoing to service you throughout the year. Good question. Thank you for asking them, by the way.
How do you learn the knowledge that you have to pass on to other people? I mean, Medicare is complicated. Dealing with the government's complicated. How do you get smart enough to do that?
I appreciate you asking. This gentleman was asking, how do I stay up top on some of this information? How do we know what we know to be able to share that knowledge with other people? And the answer is, first, you have to get licensed. And that is a rigorous process of getting licensed with Medicare. And then once you get and that's a health insurance license, by the way. But once you get your health insurance license, now you have to go through what they call the certification process. And that's with each company. So I have 11 different companies in my arsenal. So I have to certify with the 11 different companies. And then there's the media. We do that all in June and July, going up into our busy seasons, considered the annual enrollment period, which is October 15th to December 7th. So all the months starting in June and July, we're preparing for that moment by doing our certifications for the next year. So we have not only do that, I have to do 30 hours, well, 24, but 30 hours of continuing education every 2 years also. And because we enjoy learning and sharing ideas, we have ongoing meetings in my office where groups of professionals to get together. It's kind of like iron sharpening iron sometimes, but most of the times it's just making sure, hey, have you heard about this? Have you heard about that? What's the deal with this company and this network going on? So I love that question. These are great questions, but that is a good way. And like I said, we just stay on top of it because first of all, to do what I do, you have to have a heart, people, first of all, and you have to have an interest. Medicare can seem as boring as all can be, but when it's making an impact in your life or a positive, I'm all about. And so the agents in my office, we're all about continuing to know all we can know to help those people. We feel like the more we know, the more valuable we are. That's the way we look at it. Do you have a question, Tim?
The prior authorization, I noticed that's changed this year. Is that in all plans, or are there certain plans that do not have that?
Good question. This gentleman was asking about prior authorization, the thorn in my side right now. I'm getting a lot of phone calls. Prior authorization is not a new thing, by the way, but prior authorization is being required by these Medicare Advantage plans, which is your HMOs and your PPOs, but not so much on the Medigap, also known as Medicare supplement plans. That's where the most freedom in Medicare literally is on the federal bill payer, which is the Medigap plan. But the Medicare Advantage plans, prior authorization, and what I've been told, it's not all doom and gloom. They're finding that they're having better outcomes, more healthy outcomes, happier people by keeping tabs on what they're doing. So they're also trying to, that's another way of eliminating the fraud, waste, and abuse and the overuse of some of these things that are coming across. So it's just another way of just keeping tabs because Medicare Advantage plans really are considered managed care plans as well, which means the companies reach out to these people. They reach out to their doctors. They call them every once in a while. Why is that? Is because those Medicare Advantage plans are subsidized by the government. And so in this case, the Centers for Medicare and Medicaid Services, which is one of the largest departments in the U.S. budget, that's Medicare, Medicaid, and Social Security, which handles the money. So in this case, when folks are on a Medicare Advantage, the government is, in this case, the Centers for Medicare and Medicaid Service, we call CMS. Why it's only one M and not two, but it is. They give each of these Medicare Advantage companies a stipend of money every month. That's why they say, what area do you live in? What's your zip code? Because each geographical area gets paid a certain allotment of money to help the people on Medicare Advantage plans, also known as Part C, by the way. That's A, B, and D all in one plan, known as Part C. And it's not some sort of a funky alphabet for all of us that used to think that. Part C actually means part complete. That's what it actually means. So does that answer your question? Yeah, you're welcome. Anyone, these are great. Yes. Yeah, Beth, yeah, you got one for me. Good.
Yeah, so we shared, I hear about Medicare a lot. And so I've heard these whispers like that Medicare Advantage plans have max out of pocket, or not out of pocket. The companies will only pay so much money under Medicare Advantage plans, and then they stop. Is there any truth to that?
No, they cannot. There can be no limit on how much the company can spend. However, you brought something in the beginning. You said the max out of pocket max. So that is something true, actually. That means that's a like a floor, if you will. So if someone says, hey, all your Part A hospital, all your Part B medical costs, if on Medicare Advantage plan reach this certain dollar amount, you're done paying for that rest of that calendar year. And the company takes over from the rest of the way. And there cannot be any limit on that. However, they can limit the services that are approved and not approved. But there is a max out of pocket. So the government says, even though the government Medicare, which is just an 80-20 plan with deductibles, has no out of pocket max, that 20% can lead you to bankruptcy. It really can. And it has for people. However, Medicare Advantage has rules imposed where they say, listen, if you're going to offer a Medicare Advantage plan, and many companies in this area have multiple different types of Medicare Advantage plans, they say every one of those has to have a certain threshold of, in this case, an out-of-pocket maximum, which is a dollar amount. That's range anywhere from $2,800 all the way to $14,000, depending on what plan, just depending on what you have. Again, you have a huge variety of Part C plans. And does that help answer your question with that?
I think there was like some fear tactics from the salesman.
So much fear tactics out there.
Of like, don't pick a Medicare Advantage plan. If you pick a Medicare Advantage plan, if you get cancer, they'll stop covering you. I'm like,
it's not true. Actually, I have a lot of success stories about cancer and those folks on Medicare Advantage plans. They said it was a godsend. I promise you, I've heard way more positive than everything else. Thanks for asking. That is something that people are really unsure about. A lot of times they mistake that out-of-pocket maximum for a deductible, and a lot of these Medicare Advantage plans don't even have a deductible. Sometimes for Part D, but not always, depending on what you think. Yes, sir.
Can you talk a little bit about max on prescriptions in Medicare now?
Yeah, I'd be happy to. He was asking about the max cost that someone can pay in a prescription, which is Part D world, by the way, most times. Even though there is prescription drugs inside of Part B. I don't know if many of you knew that. That's under your medical. That's usually drugs administered inside of a doctor's office. But you're referring to the Part D, which is the biggest shakeup in Medicare since 2021 and 2022 when the Inflation Reduction Act was signed. So in this case, all the chaos really just started last year. That's when they eliminated what they call that coverage gap, or it's known, people know as a donut hole. At one time, there was people paying upwards of $8,000 a year just in medication costs. Well, in 2025, they said that is no longer going to happen. So that $8,000 went down to $2,000, no more than $2,000 on covered medications, by the way. That's the key. It has to be covered. And since the government's is trying to help out some of these companies, they are saying you will have to cover all the certain drugs in every class like you used to. So it's a different story now. But now in 2026, that $2,000 is now $2,100. That went up. But again, the idea, so they're saying that any medications that are covered, with you in the company, you will not spend over $2,100. But I just want to tell you, most people don't spend more than $300 a year, just so you know. But there are the people that take the Ozempic and the Eliquis and the Jardiance and all those worlds, and that those are type of medications. A lot of times that trigger deductibles. Deductibles, by the way, that can go as high as $615, do go towards that $2,100 max out of pocket, which is good for people to know. But did I answer your question there? So $2,100 is that max, but it's on covered medications only. Words covered that's the key word. Okay, cool. Does anyone else have any questions? Yes, sir.
And so, you can read online all the reports that are predicting humans are going to live to be 120, 130 in the near future. You've got a guy on Netflix who's trying to live to be forever. With all that out there, has there been any whispers or rumors about the age for eligibility being increased or funding being decreased, or Not to say that the government hates people, but when they look at that bottom line, are there any future possibilities of those changing?
Yeah, so talking about raising the Medicare age, basically, yeah, nice question. Not so much. I haven't heard much about raising Medicare from 65 or older, but I hear ongoing, and Beth, you probably hear this as well, about people raising the full retirement age a little further along the way also. But as far as Medicare 65, and I haven't heard any changes about that. I actually tell you, I've been optimistic about Medicare improving. I tell people by 2028, if they continue to clean it up and allocate the money where it's supposed to go, I believe that Medicare could look even pretty good. I've seen Part B premiums come down over the years, and it's 202.90 currently for the average. I wouldn't be surprised if that came down. Now, I might look like a big silly fool for saying all that, but hey, but the way I look at just what I've seen, I can see Medicare improving. And that's good news for a lot of people, which is wonderful. And I guess you guys are. Yeah. You had a question here.
Yeah, my kids are starting to use the word retirement. And when is a time in life when your services would be of use to someone?
I appreciate that. Well, that depends on, so folks that are starting to talk about their retirement, that's where I do come into play with that as well, because it's a planning process. And it's not a one appointment time either. It's multiple appointments generally. And so with that, I would say whenever someone's starting to think about seriously considering retiring, they can come see me now. And then some folks that are getting ready to turn 65 that are young, because you can retire in your 40s if you want. You can retire in your 50s. So are your kids coming up on the 65 age? Is that what you're saying? Or
Not quite yet. One of them's in the 60s, so he's thinking about.
I have lots of clients that start with me right around 61, 62, and then they keep touch with me throughout the years. And a lot of times when they really start getting into the 6 to 12 months prior to them turning 65 is when they really sit down with me to figure out, especially if they're going to retire, because a lot of folks are working longer now anyway for a certain amount of reasons. But when folks that are really considering retiring, I tell them 6 to 12 months prior to that is a good bet. Yes, sir.
Age you can recommend hindered in who you can take care of? Can somebody from Cleveland come to you, like somebody's grandmother or?
Yeah, so this gentleman was asking, do they have to be around here for me to help them? Absolutely not. I'm licensed in 5 states. So, and not to mention, I'm licensed in Ohio. So a lot of times it's usually phone calls unless they want to come see me. I used to do I used to drive to folks' home my first 5 years of doing it, racking thousands of miles on my car, which is a lot. Sometimes I don't do it as much as I do. I do have a couple of clients that don't get out as well, so I will still come see them. But a lot of times, absolutely, that they want to make a phone call or anything, just to that they have some questions. By all means, I'll help out anyone who needs help. A lot of folks that are not on Medicare age now that I see in this room, well, they're helping their parents make some of these decisions. So for you all too. So if you have a question, and all the questions, in my opinion, they're all good if you ask me, because you're asking them and you're seeking knowledge, and that's important, I think. So is there?
If you're an employer and you have an employee reaching, Medicare eligibility, so you offer obviously your health insurance, is there a way to have best of both worlds where you can, assist the employer with maybe not having, that same premium cost for them to enroll in, their employer sponsored plan, but also help the employee by having lower deductible on Medicare? Is there any strategies that you've experienced with someone still working, not choosing, to completely leave their group insurance? Or I know if you choose a group insurance, you don't have to enroll in Medicare, but is there any strategies there with those that are still working?
Yes, there is. And I work with those folks a lot. So what I do is I usually weigh it out. Okay, let's talk about your employer plan. Let's talk about the pros and the cons of that cost, and then we do an analysis on that and say, hey, okay, here's what you get out of Medicare based on what's suitable for you. And so I put it back in their place. Hey, you're smart. You can make a decision. What do you feel like is better? If you go to Medicare, well, this is your cost. But as far as someone having like an employer plan as a primary and Medicare as a secondary, well, it just depends. Also, Medicare can be primary and employer plans can be secondary. It just depends on the amount of employees that are at that business. But in that case, it's really just weighing your options, finding out. I've noticed a lot of times, and I can never say I guarantee because I just it's not words I use. But in this case, when folks compare their employer plan, this day and age, this wasn't true 10 years ago. This day and age, when people are looking at their employer plans compared to what they could have in Medicare, they generally go with Medicare. I still get jealous of these plans. You should see some of the things benefits at the end of these plans, but it's neat. Anyone that's on Medicare deserves it because they're for a reason, right? But so that's that's one thing because a lot of times I don't always encourage people to have both because it get kind of pricey for them, and it's not always necessary, just depending on what they have or need it for. I mean, but it is a conversation that I have often, and we just weigh it out. Hey, this is what this looks like. This is what this looks like. What do you think? You know, and then you make the decision and you go from there. Does that help answer your question? You're good. You're welcome. Thank you for asking. That yes.
More sorry. I deal with this
all the time.
So, it's a lot of deterioration in the Medicare Advantage plans this last year. You know, they took away the silver sneakers and they took away the free groceries and then changed the doctor's list and all this stuff. I'm trying not to be cynical, but it feels like bait and switch. Okay, hey, you get on Medicare Advantage, I'm gonna give you all these free things, but they're gonna take the stuff away and then you can't have it, right? Like, what do you see the future of the Medicare Advantage plans? Do you think they're gonna continue to reduce the benefits? Will the consumer get angry enough? They have to increase them again? Or what's your opinion?
I don't know. There's a lot to that.
Yeah.
I mean, we try to unpack some of this. Deterioration of plans, no, Medicare Advantage plans are actually on the rise, they're actually getting stronger. And some of this, so don't mistake the silver sneaker. That was just one company that did that, by the way. That just happened to be a very popular company in this area that had a very popular plan, and their focus went somewhere else just for the time being. They won an award from the government that they've never won before, but it's a different folks that are just on Medicare. They're helping the Medicaid folks, but they did reduce. I feel like they put some salt in the wounds on some of this stuff, but a lot of companies didn't always just drop Silver Sneakers. Silver Sneakers is just a third-party organization that's been in the gym membership for the health insurance plans for the years. They were one of the first ones. However, there's several different versions of Silver Sneakers now. So some companies just got sick of Silver Sneakers antics because they were kind of being a little bullish at times. So they went to other companies like Renew Active or OnePass, which says, hey, well, hey, company, you can buy our service, and now all these people can use all these different gyms. And so because Silver Sneakers was making it kind of rigid for people, don't use this gym or that gym. And so a lot of companies said, nah, I won't make it because boomers and the silent generation and now Gen Xers, we like variety. And so they were saying that all sorts of different things. But they dropped the Silver Sneakers because what I understand is Silver Sneakers was getting a little prideful in their name, and that's just what I heard. It's all interesting. Of course, take it for whatever you want. But a lot of these benefits just depends. Like and I'm not sticking up for Medicare Advantage. I have a complete portfolio guy, I promise. It's based on the person. But I do a good deal of Medicare Advantage plans, of course. But in this case, there's Medicare Advantage plans that can offer $5,000 in dental for a zero premium plan. That's United Health. So there's an AARP United Healthcare plan that's the highest in the area, and you don't have to be on Medicaid to have it. That's the thing. So the food benefit, you've mentioned that as well. That was all part of the old value insurance program. Now they went to the SSBCI, and I'll just let you listen to my podcast I did in November about that. That's basically so to answer anyone that was interested about the food benefit. That was more of a COVID thing. It really was. And so folks on Medicare and Medicaid, they do get it. And they still get it, matter of fact. And a generous amount, they deserve it. But when that food benefit was going into some of the Medicare plan Advantage plans, that's more of a COVID thing. People were on hard times. They were helping them out. Here you go. But the new SSBCI rule, which when you can Google that word up, and I don't want to bore you with all that information, but it just changed it. Says, hey, that benefit's going to need to go back to the less fortunate than the folks on Medicare. Although there's still a handful of plans that offer somewhat of a food benefit inside their Advantage program. So, and some of the OTC benefits, if you ever heard of over the counter, that it's often included with that food benefit. It's not quite the same thing, but a lot of those OTC benefits are starting to open up where you can now, there's a couple thousand products instead of just a couple hundreds, which some of that blends into food. More on that to come. But like I said, it's still in its infancy with the change. These companies are trying to really kind of mold with today's generations of people and how they get their service. They're taking, there's other plans out there that help you pay for your Part B premium. So there's certain companies, that's not too good to be true. Every one of those companies has at least one, they call it a rebate or a buyback plan, or it's really not too good to be true, where there's Medicare plans out there that will help pay for that 202.90 that comes out of Social Security. They'll give you a portion of money to go pay for that, indirectly giving you a raise in your income. So they're out there. It just depends on that. Everyone's different. So that's why there's 200 plans to accommodate. So I help narrow it down. I use not only my experience, but I have the technology that tells me what today's costs are for medications on every single plan. It's really cool technology that we use, but we do that all in my office. I mean, even if you're saying I'm not going to move my plan, and you don't have to, you can still come and check it out to see, hey, am I still in the best plan? That's what it's for. So I appreciate the question. Yes, please.
Alan, I have a totally random question. When I think about the microbial comments, I don't think about Medicare.
All right. Tell me about it. Yes. What an odd place to place. Well, I'm a bit of a, that time said, hey, listen, man, we're checking out the malls to put a Medicare office in there. I'm like, it's the mall. I've been in the mall 10 years. This was right around June 2020, by the way. And I was like, oh, but come check it out. The mall in Beavercreek still a good mall. I'm like, dude, okay, all right. I said, what's the rent store? And I'm coming from a formal, kind of a stuffy office, with all the fourth floor, beautiful views, really nice. Someone walks in, and then so it's just because they're only appointment only, right? One of those things. I get to the mall. I said, okay, I'll sign a 3-year deal. And I'll check it out. That'll be my trial period with this. If it fails, it does, and I'll move on to my stuffy formal office, right? It's awesome. If you never know who's going to walk through your doors, I literally get over 1,000 people here that walk through my door, and you never know. You got to be on your toes. And so get that. So I never, honestly though, I never really was thinking that way when I got into it. I didn't thought maybe go 100, maybe. Well, I didn't even think of that high. Actually, at that time in 2020, especially with COVID, we all had plexiglass shields and everyone wore masks. It's silly. But because of a good board, in my opinion, I just continued to get better and better. And I was considered essential at that time. So I never had to close. And I still got business and we still made it through. And here I am almost 6 years later. September is our anniversary date there inside the mall. And I just did a complete rebranding and a whole remodel, which is beautiful. So I like being there. We have a new owner. I'm sure you're all aware. So far, they seem nice and fair, and I like being there. But I got to tell you, the chambers enticed me about coming to their new office as well. But I'm like, see all the options. You know what I mean? I get all sorts of walks of life just come by. I didn't know you were here. They stop on it and then have to ask you a question. But it's worked out wonderful. But great question. You're right. I always thought it was a silly idea too. But I just tried it out just to see. Like I said, here I am. Thank you. Hi.
Isn't one of the considerations you have to do is which doctors and hospitals take which insurance?
That's possible. Yeah, absolutely. So that's one of the first things we do. First 2 things we do is look up your medications, then your doctors. Medications are yes. So every company does it differently. So if you are on a Medicare Advantage program, whether it's an HMO or a PPO, we do have to look up your doctors to make sure they are in network with plans that you choose. But I start with medications first usually because that's a monthly cost for people. I got to make sure they're covered because not every company covers it. But yes, but on a Medicare supplement, which is also known as Medigap, you don't have to worry about is my doctor in network. Do I need a prior authorization? Do I need a referral? It's the federal bill payer. So whatever doctor, whatever hospital, whatever facility that holds that has the, I don't like you see my original Medicare card here, but And so if you have original Medicare, Medicare supplement picks up the 20% that leaves behind, so therefore it has to go wherever that goes. And according to the Kaiser Family Foundation, 99% of the doctors and hospitals in America and our territories accepts government Medicare. So that's freedom right there. So that's a pretty big deal. These are great questions. Thank you. Appreciate it. Did I answer your question?
Yeah, I just happened to know someone and she got cancer and she went to one of the big name cancer clinics and had to change health insurance.
That's possible. Yeah.
Medicare and had to change.
I give the example of Anthem Blue Cross and Blue Shield in Ohio State. James and the Wexner, that's pretty popular in this area. And their Medicare Advantage program broke apart last year at this time, January 1st of last year. But that was big news. However, that was just folks on Anthem's Medicare Advantage program. If folks had an Anthem Medicare supplement plan, who cares? Ohio State still accepts Medicare, they still accept your supplement, which is sweet. But yes, that is something we have to keep eye on. So, right now, Premier, which is Miami Valley, Premier is out of network with Humana and a company called Devoted Health. I don't see that happening yet. Again, those two have been out of network for several months now, so not looking good over there. Yes.
Do the traditional Medicare plans and the Medicare Advantage plans essentially cost the government about the same per patient?
Ask that again, please.
Medicare Advantage patient, does that cost the government the same amount to fund that person's care as a traditional Medicare patient?
Good question. I'm not 100% certain. What I can tell you is that if someone just had a government Medicare plan, an 80-20 plan, they would pay 20%. But where the government helps fund these Medicare Advantage programs, it would take that 20% and break it down into what they call a manageable copay. So they would take that 20% and break it down to a flat dollar amount. So they said, hey, listen, if you are into the hospital, you may pay $300 for X amount of days. And then you're done for a year. It's usually 5 to 7 days, somewhere around that point. But as far as the internal costs, I'm not 100% certain on how to answer that question. But as far as the external costs, the percentages breaking down into co-pays, that I can tell you. It's like it's
Well, my question really goes to who's actually paying for all the extra bells and whistles for Medicare Advantage?
Okay, great question. I can answer that. Yeah, the government is paying. So in that stipend, and by the way, it's right around there changes from time to time. But so meaning the Centers for Medicare and Medicaid Services says, they will say it's Aetna, and they say they'll get Aetna $1,000 a month for their specific plans. And it's all based on their star ratings, by the way. So if you're looking at a Medicare Advantage plan, you're going to want to see how many stars out of 5 they have. So that's important for you to know. The closer to 5, the more money they're receiving, by the way, from the government to enrich the benefits of the plan and to provide value. And therefore, when a company does their checks and balances correct, it makes the plans even more robust and the benefits are even nicer. So in this case, the government is given a stipend of money, a certain stipend of money for each plan and each company, and they have to figure out what to do with that money. So certain plans have certain characteristics of things that some people need, but not everyone. Some people like having an over-the-counter benefit. Some people could care less. So, but that's an expense for a company to have on those extra benefits. Same thing with dental. Dental's one of the most sought-after benefits in Medicare planning. However, some companies like to sometimes embellish on some of those because they will use them, but not everyone cares about dental. Some people are like, I got dentures. I'm like, well, you should still get your gums checked out. Help answer your question.
It does. We see our reimbursement rates for Medicare Advantage less than traditional Medicare.
I can see it certain instances.
And I think that relates to why the amount of providers change versus the regular traditional Medicare. Because providers aren't going to subsidize that eye plan or dental plan when they focus on traditional Medicare. And receive those standard rates.
And of course, all how they code everything, right? Everything's a code. That's the biggest breakdown in communication, by the way. Complaints is coding errors, by the way. That's number one complaint. Yeah. Yes.
What's the advertisement on radio? Kinetic, go here, go to this Kinetic, and you don't have to have surgery. Am I
sure? I like to Kinetic. I honestly don't know what that means.
Well,
has anyone else heard what you
can get out faster? We don't do a regular knee surgery and do something else. And I think that's the wrong word. It was on radio.
non-surgical, rheumatologists. It's advertised all the places.
Usually what we do is like, depending on how it's coded, if it's an outpatient procedure, or specialist, then there's a copay amount for that procedure. Yeah, sorry, I wasn't quite 100% certain on what you were asking, but.
It's hype big time.
Good, it's in Cincinnati, or you saw.
Well, Cincinnati, here. QC Kinetics is out in Cincinnati that basically tries to treat your rheumatologic problems. I don't know what they do, but it's not surgical.
Yeah, what we would do is look to see, when you look at your plan, see if they're in net with it, or if they accept Medicare, or anything what they do, so. And then you can always find out from there, and at least you have the information, and pay, something like that. Anyone else have questions?
I have a real quick one. What do you think they're gonna do with the ACA premium subsidies? Do you have any opinions or thoughts about that?
No, that's what I haven't done. I've been so thinking about other things I haven't.
Use your voucher, say.
No, I've lots of different things. Some people say that
They don't cover it
if
at all.
people they don't put the premium subsidies back in, they'll lose the midterm elections, so I didn't know if you had any insight to that. I don't have an educated opinion either.
Yeah. Yeah, I guess, yeah. Anyone else have questions at all? Joseph? Okay, what's up? I know you just want to know all about Medicare, don't you?
Hey, right here.
You know, I'm always there for you, bro. Yes, sir.
So, just a peculiar question, I guess. Do you think there's something wrong with the industry when we need to hire someone or get someone like you to decode the system to be able to use it?
Tell me about it. Yeah, good question. He was what's basically my role in all of this as well. And part of me wants to continue and say, am I going to be replaced by a robot before long? I don't know. I agree, because they're not going to tell you what Medicare plan at Social Security Administration, at OSHIP, they're not going to tell you anything about what you're supposed to actually get by looking up all your medication costs, your doctors, to make sure everything is lined up suitable. We do demonstrate value, especially the ones that have been in this industry for a long time. By taking, we bring in the human component of it to help people say, oh, hey, make it understandable a little bit more. But as far as making it more of to a point where will they need us anymore? Well, time will tell.
Same thing with.
All I know is I'm gonna keep on here in Beavercreek as long as I can, you know. And you know, I'm for the Gen X, right? That's right after the baby boomers. So we still like that human touch. Even though we designed Google and all of that, we still like the human interaction. Which I'm hoping that I figure I'll stay, my office inside a hall would stay relevant for at least 10 more years, I would think. At least before we're all replaced by robots. I hate to say it, and I don't mean to sound glum about it, but it's possible. Possible. You never know. Does anyone else have any questions? I think I'm right at the time.
Yeah.
We'll get a picture up here with you. We donate a book. Every week to our speaker.
Service.
In your honor. We donate to the Green County Library. And we'll get a picture of it. Now, we'll get up here in the front of the. Oh, there you are. Over here, Chris?
One side or the other, or?
How are you gonna do it?
Yeah.
Thank you.
Yeah.
Right, 1, 2, 3. Thank you.
What's the name of the book,
Thank you.
Dave? Yeah, what's the name of the book?
Priceless facts about money.
Right, Priceless Facts About Money
From the
by
beginning.
Melody Hobson.
Yes. Well, we appreciate your information. Some of good information. Probably good information.
Yeah.
That's nice, I like that shit. That's morning. Thank you.
Thank you. In your experience, But.
No, that's not.
I'll put it on fine. Which means. Is there anything else we brought up today? Yes, well, great. I appreciate that.
More information about the golf outing, there's an application, paper application on the web to the calendar and to the 17th of May. There's a link, you can download a paper application, which will tell you all about details for it. And the link below that will take you to a online reservation or sign up for it.
Thanks, Jim. Appreciate it.
At this month, it's like.
You know, I've been some parents. I was reading an article here just the other day. 2 days ago. This girl was telling her parents that when they stand up and give the pledge of allegiance in schools, she was the only one in her class that stood up. 50 something. Wow. And they were asking her what the kids said, why they did it. No, it doesn't mean anything anymore, you know, it doesn't matter.
Patience.
I thought that was dumbfounding, you know, that people think it's not worth doing anymore or it doesn't apply anymore. And I know with this group, half of it is military.
Yeah, right.
The first civil service. But it's bothered me. Be all right if we play first. On pledge of allegiance to the flag, United States. To the republic. And one nation. And this all. This all. This all. I already hear it. I figure it already done. Yeah. Where is here? I got my supervisor. What they could put that exactly back up. I am better know.
That's right. That's it.
Well, just count me out. You're the second guy. You're the runner up. You know, I think everyone's sort of thing. We're talking like 20.